Hello students, this is a short note. Write a short note on prevertebral fascia and its applied anatomy. This is a short video describing what is the prevertebral fascia, which is the third layer of the cervical fascia, the deep cervical fascia. We had learned in the last video that there are the three different, fascia, deep fascia, which covers the the neck. The investing layer of the deep cervical fascia, the pretracheal layer, and this is the prevertebral layer. This is of an clinical importance. So we will learn in very short about the prevertebral fascia. Okay. Now it is the deepest layer of the cervical fascia that surrounds the vertebral column and muscles surrounding to this vertebral, that is paravertebral muscle. Let us see the same diagram which we have seen in the last video. This is the skin cross section of the neck, okay, at the level of the esophagus. Okay, it is below the pharynx, okay, below the level, and deep to the skin is the superficial fascia, that fibrofatty layer, and this is that the first layer of the deep fascia, general investing layer of the deep fascia, or just simply the invest, which encloses the two muscle sternocleidomastoid and trapezius, and posteriorly it fuses with that of the posterior margin of the ligamentum nuchae. So this is how the general investing layer is there. We here will learn about the prevertebral layer. This is the vertebra, okay, in a cross section. This is the cervical vertebrae, body, transverse process, spine, and in front of the transverse process these are the muscle, longus colli muscle. So this what the prevertebral fascia, which is a tough membrane, covers the vertebral column anteriorly, then it covers to the muscles, the paravertebral muscles surrounding to the vertebral column, and then it comes and gets attachment posteriorly through the posterior margin of the this ligamentum nuchae, deep to the general investing layer. See this, it is coming and investing here. Now here it lies between, deep to the fascia, which is between the posterior margin of sternocleidomastoid and anterior margin of trapezius. This is the single lamina or layer, and this area is the posterior triangle of the neck. So this fascia, the prevertebral fascia, in this region forms the floor of the posterior triangle. This is the floor because this is the posterior triangle. This investing layer will form the roof, and this will form the floor of the posterior triangle. I will show you from the atlas this diagram which is forming the floor between the muscle sternocleidomastoid and trapezius. Again, this is the theme dissector volume 3. It is authored by me and published by the theme. Okay, I am thankful to them for using this diagram. Okay, let us see this. This is the investing layer. Okay, this is the investing. We have cut then the investing layer from the area of the posterior triangle. This is the posterior margin or the posterior border of the sternocleidomastoid, anterior border of the trapezius, and in between this triangle is the posterior. So the roof is gone, removed the roof, which was also formed by the general investing layer of the deep fascia, which is intact in this diagram. See here, this was the posterior triangle and this is that roof, and if we cut this roof of the general investing layer of deep cervical fascia, then we will go in the posterior triangle here, and whatsoever fascia you are seeing which is covering to the deeper muscle, paravertebral muscles here, which are surrounding to the vertebral column, this fascia is the vertebral fascia. Okay, the prevertebral fascia, and this prevertebral fascia in this region is forming the floor of the posterior triangle, which in this cross section, this was the part which was seen deep to the roof of the posterior triangle. So this is the floor of the posterior triangle. So you have seen the extent in the horizontal disposition. You have seen that it covers the muscles and the vertebral column completely. Okay, going back to the posterior margin of the this ligamentum nuchae. Coming back to the other description of this. Now this fascia, that is the prevertebral fascia, it lies deep to the pharynx and esophagus. In this diagram, since this was the esophagus, so it lies deep to the esophagus. But if you go to the higher level, then this esophagus is continuous with the pharynx, that is first to the laryngopharynx, oropharynx, okay, like that it will ascend up. So this fascia covers the pharynx, lies deep to the pharynx and the esophagus. Now, this fascia covers the floor of the posterior triangle, which I have shown you in the diagram and explained how it covers the floor of the posterior triangle. And deep to the floor, there are the muscles. Paravertebral muscles are there. Now, this fascia, if we see it into the vertical extent, till now we were seeing in the horizontal extent the prevertebral fascia. Let us see the same diagram here, and we will see the prevertebral fascia. Above it is attached to the base of the skull. This is the sphenoid bone. This is the sella turcica, pituitary fossa is here. Okay, and at this base, this prevertebral fascia is attached to the base of the skull, from where it runs downward. Okay, in the midline it will cover to the vertebral column, that is the vertebral bodies, cervical vertebral bodies and intervertebral disc. Then it will enter in the thoracic region, and in thoracic region it will then blend with the anterior longitudinal ligament, okay, of the vertebral column, and then it will fuse with that of the T4 vertebra, thoracic fourth vertebra. So this extends in the thorax up to the thoracic fourth vertebra. Now the space is here between the vertebral column, here covered by anterior longitudinal ligament. Okay, so in front of the bodies and intervertebral disc, there is a space called as the prevertebral space. Okay, it is there. Now in front of this fascia, the prevertebral fascia, okay, this space, the prevertebral space was, okay, it was just in front of the space but posterior to that of the prevertebral fascia. But if you will see the space which is in front of the prevertebral fascia, it is just posterior to the space called as the retropharyngeal space. Nasopharynx, oropharynx, laryngopharynx, and then the esophagus, they will have a space that is called as the retropharyngeal and retroesophageal space, which is usually filled with the fibrofatty tissue. Okay, fibro. And this is the plane on which the larynx and pharynx, they move during the process of the swallowing or deglutition. Thus, this prevertebral fascia provides a hard base on which the movement of the viscera of the neck can take place. Okay, so this you have understood the vertical extent, and I have told you about the horizontal explain. Okay, now both the brachial and cervical plexus lies deep to this prevertebral fascia. Okay, so the brachial plexus and cervical plexus, they are embedded deep to it. In this diagram you can see some of the branches which are coming from cervical plexus here. Okay, this is the cervical plexus, which after piercing this prevertebral fascia is giving the various branches. Okay, deep to this lower area there is the brachial plexus, which it is not shown. Let me go if it is shown. Yes, I think it is shown here. Now the prevertebral fascia is removed in this diagram, and you can see the muscles here in the floor, and then you can see also the cords of the brachial plexus. So thus there are two plexuses deep to this fascia, cervical plexus and that of the brachial plexus is here. Okay, right. Now then this fascia is pushes the axillary sheath as an axillary sheath, as a sleeve-like extension of the fascia around the subclavian artery and brachial plexus while they are going to the axilla. So from posterior triangle, the subclavian vessels and the brachial plexus, which lies deep to the prevertebral fascia, will push its way to go into the axilla, and while these structures from the posterior triangles they are going to the axilla, they will carry a sheath, and this sheath is formed by the prevertebral fascia, which is called as the axillary sheath because it extends into the axilla. I hope that you must have understood the vertical and the horizontal disposition of the prevertebral fascia. Okay, thus it is tightly covering to the vertebral column and muscle attached onto it. Okay, muscles which are attached onto it. Let us come to the applied because it is of the clinical significance. The prevertebral fascia is of clinical significance. There are two clinical significance which are attached to that this fascia. One is there may be the collection of the pus behind the prevertebral fascia. Let me tell you, collection of the pus, okay, in the this space, the prevertebral space, okay, between the prevertebral fascia and in front of the vertebral bodies or the ligament, with this column, okay, there may be the collection of pus, and this pus, if it is collected here, it cannot go beyond the base of the skull here upward, then it will trickle downward, and in the lower part it will be limited in the T4 till, but it will form a collection of the pus anywhere, okay, in the this midline, okay, anywhere in the midline, but it may also spread laterally, okay, deep to this prevertebral fascia. Let us see here. If suppose there is a collection of pus, it will go laterally. It will go laterally in front of the muscles, paravertebral muscle, but will lie deep to the fascia. This may extend deep to the floor, which is the floor of the posterior triangle here, and pus may go up to here in the back side, right up to the ligamentum nuchae, which is quite rare. It will extend either in the midline or laterally up to the floor of the posterior triangle. And as I said that the prevertebral fascia forming the floor of the posterior triangle lower down extent as the axillary fascia, hence the pus of this prevertebral region will extend into the axilla. It may extend into the axilla, right? Let us see this, this abscess formation, okay, deep to the prevertebral fascia, deep to the. See this diagram, I have just drawn a diagram, and here it is the pharynx, okay, this is the pharynx is here, and this is the prevertebral fascia which is lying posterior to that of the pharynx here, okay, these are the vertebral body, and this will lead to the formation or collection of the pus in front of the vertebral bodies to begin with, and usually this collection of the pus is called as the chronic retropharyngeal abscess. Retropharyngeal means it is behind the pharynx. Hence this collection of pus is called as chronic. But this collection of the pus is deep to this prevertebral fascia. In the green color I have drawn, you can zoom this diagram. Let me zoom also for you, okay, little bit more, right? So this collection of the pus is may be there, which is deep to the prevertebral fascia, and as I said, mostly this chronic retroabscess okay, pharyngeal abscess will lie, okay, in the midline, but then it can spread laterally, which may go to the floor of the posterior triangle deep to the prevertebral fascia and may extend as axillary sheath. Now, what is the reason of this chronic retropharyngeal abscess? Chronic means it is there since long time, okay, and this is usually due to the infection of the vertebral bodies, especially cervical region of the vertebral bodies, where it is infected with the TB, tuberculosis. Okay, you must have heard the name TB infection, okay, or disease. And this bacilli or the bacteria will settle in the spongy bone of the body of the vertebra and will destroy it and will form a cold pus. That means it will not, will be reacting like that of the other infection. It is a slow cold infection, and this goes for years, the months here, and this is that's why called as chronic retropharyngeal abscess. That means if you will ask the patient to open the mouth, the posterior wall of the pharynx, as I have drawn here, will be seen, and in the middle of the posterior wall of the pharynx a swelling will be seen because of the collection of this pus in the chronic retropharyngeal but it is deep to the prevertebral fascia. Now, then there may be an acute retropharyngeal abscess. Acute means which will take the formation of the pus or the abscess will take only few days, and it is very painful. Okay, it is very painful, and this is associated with the neighboring tissue inflammation. And here the collection is of the pus is due to the infection in the lymph node which lies posterior to the pharynx. This is again the wall, pharynx, and this wall of the pharynx on posterior aspect is covered by a fascia. I have drawn it in green, and this is called as buccopharyngeal fascia. And see that this buccopharyngeal fascia fuses with that of this prevertebral fascia, our fascia, cervical fascia, in the midline. That means any pus from the right side will be prevented to go to the left side. That means the swelling or the abscess or collection of pus, which is acute pus, okay, and this is usually due to the infection of the lymph node, okay, pus formation of the lymph node, which will increase. And if you will ask the patient to open the mouth, then in the posterior wall of the pharynx, in oropharynx, you can see that swelling is on one side of the midline, because the swelling is limited only on one side, because this swelling is taking place between the prevertebral fascia and the buccopharyngeal, and since they are fused in the midline, it cannot go to, so it will remain on one side. And this kind of the infection or formation of the abscess, which is quite acute in front of the prevertebral fascia, is called as acute retropharyngeal abscess. And sometime, this acute retropharyngeal abscess, which is on one side due to the fusion of the buccopharyngeal and the prevertebral fascia, this is the acute retropharyngeal abscess. And this kind of the short note is usually there, usually a short note is there because it has a lot of the clinical importance, and you have to define the retropharyngeal abscess if it is occurring deep to the prevertebral fascia or in front of the prevertebral fascia, and what is the difference between the two, and what is the their cause of origin, why they occur, etiological cause as it is called. Thank you very much for watching this video on the prevertebral fascia and its applied importance.